Hi, I'm Dr. Laura Lászik, Junior Editor of the International Journal of Dermatology. Welcome to In Focus, where we highlight an editorial selection of noteworthy papers featured in the latest edition of our journal. Onychomycosis is something that we see quite often, but when nail separation is the main finding, it can be difficult to determine whether the cause is psoriasis, onychomycosis, or simply trauma. In a multi-center retrospective study, Secchi and colleagues examined onycholytic fingernails with dermoscopy, both before and after clipping away the detached portions of the nail plate. Once the nail bed was exposed, they assessed it under both dry and wet conditions. What they found was that the appearance after clipping differed depending on the underlying diagnosis. In psoriasis, the nail bed typically showed abundant, thick, white scale that was firmly attached and remained immobile. Onychomycosis, on the other hand, was more often associated with moderate to large amounts of yellow or yellow-white scale, which tended to be less adherent and more mobile when water was applied. In traumatic onycholysis, the scale was generally sparse, thin, loosely attached, and mobile. The key clinical takeaway is that nail clipping does more than simply improve visualization. It can reveal reproducible features of the nail bed that may help guide mycological testing and support more targeted management decisions. However, these findings should still be interpreted cautiously. The study included a relatively small number of patients and excluded mixed etiologies, even though overlapping causes are common in everyday clinical practice. When imaging technology struggles to see through the skin surface, a simple preparation step may make a meaningful difference. Michelini and colleagues focused on actinic keratoses, in which hyperkeratosis can obscure the dermal-epidermal junction, making LC-OCT images more difficult to interpret. They investigated whether briefly hydrating the lesions before imaging could improve visualization. The researchers compared two approaches: occlusion with tap water and the application of a salicylic acid ointment. After hydration, the dermal-epidermal junction became substantially easier to visualize. Clinicians were also more confident when assigning PRO scores, and many lesions that had initially been assessed with low confidence were reclassified. Interestingly, both hydration methods appear to be similarly effective. The clinical takeaway is very practical. Sometimes improving an image begins with better preparation. A brief, inexpensive hydration step may improve optical access and increase diagnostic confidence before LC-OCT imaging. However, an important question still remains. Although hydration improved image quality and interpretation, further studies are needed to determine whether this ultimately leads to better treatment decisions or improved patient outcomes. Trichoscopic interpretation is not one size fits all. Recognizing that skin phototype may shape the visibility and appearance of diagnostic features, Keladi and colleagues examined the trichoscopic spectrum of primary cicatricial alopecia across diverse populations in their international multicenter study. Loss of follicular openings was the most consistent feature across all skin types, but several inflammatory and pigmentary signs varied by skin color and alopecia type. Notably, signs of clinical and trichoscopic activity mainly appeared within the first 5 years of the disease, a period when inflammation tends to be more intense. Recognizing that the scalp does not present the same diagnostic canvas across all patients is essential for accurate interpretation. Rather than establishing a new diagnostic algorithm, this study highlights that trichoscopic patterns can vary across phototypes and should not be expected to appear identical. Embracing these variations may improve early disease recognition and help clinicians identify the most informative biopsy site. Can alternative wavelengths reveal what conventional dermoscopy leaves behind? Addressing this question, Acral, Mart, and colleagues compared sub-ultraviolet reflectance and ultraviolet-induced fluorescence dermoscopy in the evaluation of acral melanocytic lesions. A retrospective study explored whether these emerging imaging modalities could uncover additional diagnostic information beyond standard dermoscopy. Conventional dermoscopy remains superior for visualizing several key diagnostic features, including parallel ridge and furrow and fibrillar patterns, dots and clods, radial lines, blue-white structureless areas, and blotches. In contrast, sub-ultraviolet reflectance dermoscopy enhanced the visibility of eccrine duct openings, while features such as scale, ulceration, and lesion margins were consistently appreciated across all imaging approaches. The future of dermoscopy may not lie in replacing existing tools, but in seeing familiar lesions through new eyes. Enhanced visualization is only the first step toward better diagnosis. Early detection of primary cicatricial alopecias is essential since follicular destruction cannot be reversed. A study by Trainee and colleagues investigated patients with conditions such as lichen planopilaris, frontal fibrosing alopecia, discoid lupus erythematosus, folliculitis decalvans, or dissecting cellulitis using line-field confocal optical coherence tomography. Beneath the surface, each scarring alopecia subtype revealed its own diagnostic fingerprint. In lichen planopilaris and frontal fibrosing alopecia, LC-OCT showed follicular hyperkeratosis. In discoid lupus, it revealed inflammatory changes at the dermal-epidermal junction. In folliculitis decalvans and dissecting cellulitis, it showed abscess-like patterns. Yet, in advanced stages, all pathways converged on the same endpoint: follicular destruction, sebaceous gland loss, and dermal sclerosis. The future of diagnosis may lie in technologies that help clinicians see disease activity before committing to the scalpel. LC-OCT shows promise as a real-time complement to trichoscopy and histopathology, offering new possibilities for identifying active margins and selecting the most informative biopsy sites. While still exploratory, these findings open an exciting avenue for more targeted and precise diagnostic approaches. As AI shifts from clinics to smartphones, a key question becomes increasingly important. How much confidence can we place in direct-to-consumer skin cancer platforms? Sharifi and colleagues compared DTC services in the US and Europe, assessing AI use, clinician oversight, performance claims, regulations, costs, and follow-up options. Their analysis showed significant differences between the markets. US platforms mainly served as educational tools, teledermatology services, or imaging accessories, and often lacked FDA clearance. European platforms were more likely to have CE marking and to link findings with follow-up advice. However, CE marking indicated regulatory compliance, not clinical effectiveness, and performance data varied widely, often based on company-specific data, making comparisons difficult. Perhaps the most important takeaway extends beyond accuracy alone. Across both markets, autonomous AI triage without mandatory dermatologist oversight emerged as the principal safety concern. A falsely reassuring result may delay appropriate care, while ambiguous follow-up pathways can leave responsibility unclear. For clinicians and patients, the main concern isn't just a platform's claimed accuracy, but also who interprets the results and what happens next. Could a medication prescribed to protect the heart also influence skin cancer risk? Addressing this crucial clinical question, Mall and colleagues combined a large retrospective cohort analysis with laboratory experiments to investigate the relationship between diuretic exposure and cutaneous squamous cell carcinoma. Their findings suggested an increased risk, with the strongest association observed for potassium-sparing diuretics and a potential dose-related effect with repeated treatment cycles. Their findings suggested an increased risk, with the strongest association observed for potassium-sparing diuretics and a potential dose-related effect with repeated treatment cycles. To explore the underlying biology, the authors complemented their epidemiological findings with in vitro experiments. High concentrations of spironolactone promoted proliferation in cutaneous squamous cell carcinoma-derived cell lines, whereas hydrochlorothiazide and furosemide showed no comparable effect, suggesting that individual diuretic classes may influence carcinogenic pathways through distinct mechanisms. While these findings are quite intriguing, they're not meant to discourage essential cardiovascular treatments. Rather, the study opens an exciting new area of research, highlighting the importance of personalized skin checks and photoprotection, while setting the stage for future studies to better understand how common medications might influence long-term skin cancer risk. The lasting impact of atopic dermatitis may extend far beyond the skin, leaving emotional scars that persist long after childhood. Exploring this often overlooked dimension of the disease, Aliwa and colleagues investigated how adults with physician-confirmed atopic dermatitis recalled experiences of social rejection during childhood and adolescence. Social rejection emerged as a common and lasting experience among individuals with atopic dermatitis. Those with childhood onset disease more frequently recalled exclusion, verbal and physical aggression, avoidance, shame, and loneliness, highlighting the profound psychosocial burden associated with developing the condition early in life. Treating the skin is only part of the journey. The findings of this study emphasize that atopic dermatitis can shape emotional well-being long after childhood, making psychosocial screening, stigma reduction, and peer support essential components of a truly comprehensive care. These papers from our August issue collectively demonstrate that improved visualization, considering clinical context, and comprehensive care pathways can enhance dermatology from the nail bed and scalp to digital triage and long-term psychosocial well-being. If today's highlights sparked your interest, you'll find the full articles along with much more in the International Journal of Dermatology. Thanks for tuning in. Until next time.